Hello there. Today, we're going to talk about something that can be, well, a little worrying and definitely uncomfortable. That feeling of having trouble swallowing. We're going to break down what it is, why it might be happening, and most importantly, what you can do about it.
But first, before we get started, please remember that this is just for educational purposes. It's not a substitute for professional medical advice, diagnosis, or treatment. It's so important to always talk to your doctor or another qualified healthcare provider about any questions you have regarding your health.
So, let's dive in. Have you ever been in the middle of a meal and felt like the food just isn't going down the right way? You know, that feeling like it's caught in your throat or maybe even your chest? If that sounds familiar, I want you to know you are definitely not alone. Let's figure out what's going on. All right, so first things first, what do we even call this? Let's put a name to that feeling because, just understanding what it is can be a really big first step.
Doctors have a medical term for it. It's called dysphagia. Let me say that again. Dysphagia. Now, I know it sounds like a big, complicated word, but it's really just the official way of saying you're having trouble swallowing food or even liquids.
And here's something you should know. This is not some rare, unusual thing. It's actually a really common issue, especially for folks over the age of 65. So if this is happening to you, trust me, so many other people are going through the same thing. We can think about this problem in a couple of ways. The first one is what you might call a starting problem. This is when the trouble happens right at the beginning, in your mouth or your throat as you're trying to get the swallow going. You might find yourself coughing or even choking a bit.
And then there's the other kind, which we can call a pathway problem. This is when the swallow starts just fine, but then it feels like the food gets stuck on the way down. That pathway, the tube that connects your throat to your stomach, feels like it has a roadblock.
Okay, so we've put a name to it, but why? Why does swallowing, something we do without thinking all day long, suddenly becomes so tricky? Let's take a look at the causes.
Probably the easiest way to understand this is to think of swallowing like a big team effort. It's not just one thing happening. Your brain, your nerves, and a bunch of muscles all have to work together perfectly to get the job done. And here's how that team works. First, your brain is the coach. It sends out the signal. Okay, team, time to swallow. Then, the muscles in your mouth and throat get the message and they jump into action. And finally, the pathway, your food pipe, clears the way for the food to head down to your stomach. It's a three-step play every single time.
So you can see how a problem can pop up if any part of that team isn't doing its job. You could have a signal issue where the messages from the brain or nerves get mixed up, maybe like after a stroke. Or you could have a pathway issue where something is blocking or irritating the food pipe, something like acid reflux.
Okay, now this next part is really important. While sometimes swallowing difficulty is just a minor thing, there are definitely some signs that mean it's time to check in with your doctor. Let's go over them.
We sometimes call these alarm symptoms because they're waving a little flag telling you to pay attention. Things like losing weight when you're not trying to, or if the problem seems to be getting worse really fast. Also pain when you swallow, or coughing and choking a lot during meals. And if you're even having trouble swallowing your own saliva, that's your cue. Any of these mean it's a good time to make that call.
All right, so knowing when to call is a huge step, but what do you do next? I want this part to feel really empowering for you, because there are simple, clear things you can do to help yourself.
Honestly, one of the absolute best things you can do is to just be prepared for your doctor's visit. When you go in with clear information, you're not just a patient, you're an active partner in figuring this out, and it's easier than you think.
It really just comes down to these three simple things. 1. Jot down your symptoms. When does it happen? Is it with solid foods, liquids, both? 2. Make a quick list of all your medicines. And yeah, that includes vitamins and supplements. And 3. Just talk to your doctor. Tell them everything you've written down. No detail is too small, I promise.
And I want to leave you with this because it's so important to hear. This isn't always something you just have to live with. The fact is, many causes of swallowing difficulty can be treated. Once your doctor finds the reason, you can start working on a solution. Finding the why is the key.
So, what's the big takeaway here? It's that understanding what's going on inside your body is the first step, and knowing how to ask for help is the next. Finding an answer, finding relief, it all starts with just one conversation. So, are you ready to take that first step?